Hi, my name is David Pressler. It's an honor today to be interviewing one of the top doctors on vitamin D, Dr. Michael Holick. It's a great pleasure to be with you today and want to find out a little bit about what's going on with vitamin D and all the details of what you're researching.
So it's my pleasure to have this opportunity to talk with you. And so I started out at Seton Hall University in 1968, graduated with a degree in chemistry, and then went off to the University of Wisconsin to the biochemistry department, and happened to be in the right place at the right time, and basically made a sour's ear into a golden purse. And my first project for my master's degree was the identification of the major circulating form of vitamin D in human blood. And I developed a whole new system to separate fat-soluble compounds in human blood. And after just 3.5 months, I completed my research and got my master's degree. And then went on and had the opportunity to work on identifying the active form of vitamin D, known as 1,25-dihydroxyvitamin D. And I developed new separation techniques, and working with my mentors, we were the first in the world to structurally identify it. Why is that important? Because the active form of vitamin D is made in your kidneys. Why is that important? Because we knew that kidney failure patients had severe bone disease, and they had a resistance to vitamin D, but nobody understood why.
What does a resistance to vitamin D mean?
So in other words, that they couldn't respond to vitamin D, that their bones were really wasting away. And so all of a sudden the light went on, right? Because if your kidneys make it, and if you have kidney failure, then you cannot make enough. And therefore, as a result, you can't bring the calcium into your body, and you can't put it into your bones. And as a result, it causes severe bone pain, increases risk of bone fractures, and many of those patients were wheelchair bound. And so after I got my PhD a year later, I then did a full-time postdoc, and then went to medical school at the University of Wisconsin, 1972 to 1976. And during that time, because I'm also an organic chemist, my roommate and I were the first to chemically make the active form of vitamin D. It took us 2 years, but the material that we made, we then were able to give to patients with kidney failure that were wheelchair bound. And we demonstrated that that active form of vitamin D caused dramatic improvement in their bone health, and resulted in many of them being able to walk again and almost have normal functioning lives.
You had miracles with this.
So this is my first introduction to translational medicine.
What does that mean, translational medicine?
What it means is that you have good science, and how do you apply that science to health and to medical care, right? And so the translation, of course, is we identified the active form, chemically made it, and now identified a reason for patients with kidney failure why they had bone disease, and translated that information into actually treating them. And so that was the first demonstration of the active form of vitamin D being very beneficial. I became then fascinated with why is it that vitamin D is a sunshine vitamin? And so why do humans depend on sun for their vitamin D requirement? And so I spent the next decade working out the whole process, how you make it in your skin, what is the effect of aging, skin pigmentation, sunscreen use, latitude, time of day, altitude, on the production of vitamin D. And so I worked with a group out in California onto Metrics Inc., and we developed an app. So it's called DMinder, DMINDER.info. And you can use it on your iPhone or on your Android. It's free, and it'll tell you anywhere on this planet when you can make vitamin D, how much vitamin D you make, and it warns you to get out of the sun so you don't get a sunburn.
Yeah.
Because we did studies around the globe where we put out samples and also got skin samples and showed when you can make vitamin D and how much you make and all the rest.
But what are the most important issues today that you want to delve into? Because you probably could talk for 4 hours.
You're right. And so, from my perspective, what everybody needs to know is that everybody needs vitamin D from birth until death. The major source of vitamin D is sensible sun exposure. And because it's...
And it's free, right?
Well, not only is it free...
Well, you got to pay for your trip to Miami.
Right. But the problem is that in this day and age, for example, the American Academy of Dermatology says you should never be exposed to one direct ray of sunlight. And as a result, it's caused a worldwide potential pandemic of vitamin D deficiency. It's estimated that 40% of the world's population is vitamin D deficient.
Are you saying that it's false that they're saying don't go in the sun?
What I'm saying is sensible sun exposure. I mean, humans have always, they were born, right, and lived in sunlight. Our hunter-gatherers were outside every day exposed to sunlight. And so our body adapted to that requirement. And what's remarkable is that there's essentially no vitamin D in your diet. So oily fish like salmon, mackerel, herring, there's only about 500 to 1,000 units in a serving, 3.5 ounces, right? Milk is fortified with vitamin D, but a tiny amount, 100 international units. And
how much do we need on a daily basis?
I'll tell you in a minute.
Yeah.
And also, some yogurts, for example, are also fortified with vitamin D. And mushrooms exposed to sunlight contain vitamin D. Those are the only natural and fortified foods containing vitamin D. Most of the world forbids fortification of foods with vitamin D, and that's for historical reasons. And so, long story short, how much do you need, right? And so the Endocrine Society practiced guidelines on vitamin D, and I chaired that committee. And all of the members of that committee were experts in vitamin D. And
Probably was a pleasure to be with them, huh?
It was great. And they're all my friends and colleagues. And so we recommend infants 400 to 1,000 units a day, especially breastfed infants. There's essentially no vitamin D in human breast milk. And so even the American Academy of Pediatrics recommends 400 units of vitamin D a day for infants from the time they're born.
Incredible. Did you know?
Children, 600 to 1,000 units a day. And teenagers should be treated like adults, 1,500 to 2,000 units a day.
Now, if you have sun, does that affect how much you need to take in a pill?
So that's a good question, and I'm asked that question all the time by my patients. And the problem is, unless you're a hunter-gatherer, right, half naked, outside every day, you cannot get enough vitamin D from simple casual exposure to sunlight. You'll get a little bit, but you won't get a lot. And we actually did a study of over 2.3 million samples, blood samples throughout the entire United States. And we looked at the blood levels in every day of the year and showed very nicely that everybody is basically vitamin D deficient or insufficient at the end of the winter, and that you raise your blood level by about 9 at the end of the summer by casual exposure to sunlight. And it doesn't get to that level that we want you to be.
Could you say those numbers again?
So it turns out that you're vitamin D deficient or insufficient at the end of the winter. The levels are in the range of about 18 to 22 nanograms per ml for 25-hydroxy vitamin D. At the end of the summer, at the peak around mid-September, it's at around 29 nanograms per ml. However, we want you to be at least 30 nanograms per ml based on the Endocrine Society practice guidelines.
And by using this app, do you know how much vitamin D is deficient in your body, actually, or just
so
how much?
You could get a blood test called a 25-hydroxy vitamin D blood test by your doctor.
Mm-hmm.
The problem is that it's not always available, can be expensive, and often doctors don't want to do it because they say, well, if you have a healthy diet, you don't have to worry about it. And that's just not true.
Mm-hmm.
And so I recommend, at least for all my patients, that children should be on 1,000 units of vitamin D a day, just make it simple. And for adults, 2,000 units a day. And if you're obese, you need 2 to 3 times more, because vitamin D is fat soluble, and so it gets diluted in your body fat.
So which are the best products to take? Which companies do you recommend?
So I don't recommend companies,
Yeah.
but what I do recommend is a national brand. And because usually the FDA is regulating it, and so CVS, for example, or Nature's Made, or any of the products that are on the market are perfectly fine.
And if you get it in a multivitamin, that's not as good?
It's just as good. And so Centrum, for example, has 1,000 units of vitamin D, which is great. I personally take 6,000 units of vitamin D every day.
And you feel it? The difference?
Well, I mean, I think I just did a 20-mile bike ride yesterday. And I play tennis, garden, I still am full-time. And so whether it's the vitamin D or not, hard to say. But I have all my patients are on at least 2,000 to 3,000 units of vitamin D a day, and most are on 5,000 units of vitamin D a day, and they're doing great.
Do you have any interest in other vitamins and minerals that should be part of one's diet, or are you just focused on vitamin D? What do you recommend about all other aspects of nutrients and supplements?
Healthy diet is good, and I personally take a multivitamin every day. And do I really need it? Don't know, because I have a pretty healthy diet of fish and salads, leafy green vegetables and fruits.
That's what Noreen makes.
Right. And so theoretically, you can get most of the nutrients from dietary sources. Sometimes for elders, they can be magnesium deficient, and that can be problematic. And so I often will recommend to my osteoporosis patients that a magnesium supplement is very reasonable. Calcium is also very important because milk is your major source of calcium for the most part. Dairy, there's about 300 milligrams in 8 ounces of skim milk, right? But most people don't drink milk. Orange juice is now fortified with calcium and vitamin D. We actually did the seminal study for Minute Maid, and the FDA gave approval for vitamin D fortification of orange juice. And there's 300 milligrams of calcium in calcium fortified orange juice, so that's another option, right? But if you don't have those sources, there's very little calcium in your diet. So as a result, I recommend to my patients, if they don't want to have dairy or they can't tolerate dairy, right, or soy milk or almond milk or oat milk, right, which is also fortified with calcium, you need to take a calcium supplement. And the recommendation for adults is 1,000 milligrams a day total from diet and or supplements.
Of calcium?
Correct.
1,000 milligrams. And for vitamin D, it's more, 3,000?
So I recommend for all my patients at least 2,000 to 3,000, and many take 5,000 units a day.
That's a lot more than the calcium.
Well, but they're different. I mean, it's actually much, much less because we're talking about units, right? Not milligrams, right? If you were to take milligrams of vitamin D, it would cause severe toxicity. So we're talking about
units and milligrams. You have to notice that
micrograms.
difference.
We're talking about 1,000-fold less. And in fact, we did a study in 191,000 blood samples of COVID-positive patients throughout the entire United States. And we reported that you have a 54% higher risk of acquiring this infection if you're vitamin D deficient. And it doesn't matter what your age, sex, or ethnicity is. Vitamin D looks like it helps to reduce risk of infectivity. Also, we know from another study that we conducted here at this hospital that those patients that came in that had a higher blood level of vitamin D, known as 25-hydroxy vitamin D, lower was their risk of having significant complications and dying of the infection. We did another study in Iran and showed that those that came in, more than 74% had severe infection. If they had vitamin D on board, it reduced their risk of dying by more than 50%.
Say that again?
If they had a blood level of 25-hydroxy vitamin D that we consider to be above 40 nanograms per ml, those over the age of 40 had a 50% lower risk of dying of this infection even when they presented to the hospital with severe infection and complications.
Wow. So it seems like it's part of the big picture here.
No question. We know that vitamin D plays a critical role in immunomodulation, in modulating your immune response. It helps to fight infections. We know this very clearly, that the cells that are called macrophages, kind of the Pac-Men in women in your body that are gobbling up viruses and bacteria.
They're called a macrophage?
Macrophage.
Right,
Yeah.
I've seen that.
And so those cells activate vitamin D locally. And the reason for that is that the active vitamin D tells the cell to make a protein called a defensin protein that then causes death to bacteria and also prevents infectivity of viruses.
And once again, a complex of other vitamins, or like a package of defensive, vitamin, maybe a, combination of something that you would give somebody. Would you put in calcium and some of the other goodies?
So I think that for overall health and welfare, right, and especially I focus on bone health, right, in my clinic, is that adequate calcium and adequate vitamin D and exercise. And the best exercise for your bone health, for both your spine and your hip, is walking 3 to 5 miles a week. It's the pounding on the pavement that translates to your hip and spine. It improves muscle tone, less likely to fall, and maintains the bone strength.
Wow.
We did a study in pregnant women and showed that preeclampsia, which is the most serious complication of pregnancy, is markedly reduced if pregnant women are taking vitamin D and have an adequate vitamin D status. We also showed that at this hospital, in over 200 women that were giving birth, is that to give birth requires good muscle function and good muscle tone, right, in the pelvic region. So pregnancy and vitamin D relate very importantly, because we've shown in pregnant women who are vitamin D deficient that they have a much higher risk of having preeclampsia, the most serious complication of pregnancy.
What is that?
And so preeclampsia, it causes high blood pressure, and it can actually lead then to what's called eclampsia, which can lead to death. So it's a very, very serious complication of pregnancy. And pregnant women who are vitamin D sufficient have a 400% reduced risk of being preeclamptic during pregnancy. We also showed that vitamin D, of course, is very important for muscle function, which is important for the birthing action. And so we did a study in our hospital over 200 women and showed marked reduction in needing a cesarean section just by being vitamin D sufficient during pregnancy. Also, other studies have shown that premature births are markedly reduced for pregnant women who are vitamin D sufficient. So it's very important for women, as soon as they become pregnant, but even before that, that they should be having adequate vitamin D intake. And my recommendation, based on the Endocrine Society practice guidelines, is to take between 1,500 to 2,000 units a day on top of your prenatal vitamin. Is perfectly fine and safe. And also, it's been demonstrated that infants born of women who are vitamin D sufficient, they have a marked reduced risk of acquiring wheezing disorders. And so all of these are very relevant for pregnant women to be thinking about the health of their infant and child. We also know that during childhood, vitamin D is very important. Why? Some studies have shown, for example, in Finland, that Finnish infants getting 2,000 units of vitamin D a day and followed for 31 years reduced their risk of acquiring type 1 diabetes by 88%. Also, we know that if you live above Atlanta, Georgia, for the first 10 years of your life, and are more prone to vitamin D deficiency, you have a 100% increased risk of developing multiple sclerosis, not only for the first 10 years, but for the rest of your life. It's imprinted. So we know for children that they need vitamin D, and there are multiple studies, including the ones I just discussed, that vitamin D sufficiency during childhood reduces risk of autoimmune disorders later in life. For adults, there's good information to suggest that it can reduce risk for many deadly cancers, including breast cancer and colorectal cancer. It reduces risk for neurocognitive dysfunction disorders like Alzheimer's disease and depression, reduces risk of heart disease and type 2 diabetes, and reduces risk of infectious diseases like COVID.
So how do you make vitamin D? You can actually make it yourself in the lab?
So most vitamin D, there's two vitamin Ds. There's vitamin D2 and vitamin D3. The first vitamin D that was identified was vitamin D2. And vitamin D2 comes from yeast and mushrooms, and is available as a pharmaceutical in the United States as a 50,000 international unit dose. And so what I typically do for my patients is give them 50,000 units of vitamin D once a week for 8 weeks, fill up the tank, and then I put them on 50,000 units of vitamin D every 2 weeks thereafter. The other source of vitamin D is vitamin D3, which is what you make in your skin. And the major source of vitamin D3 comes from sheep's wool lanolin, where they obtain the cholesterol, and then they do chemical reaction that ultimately leads to the production of vitamin D3. And that's what's typically used in food fortification as well as for supplements.
So it comes from the sheep's wool because they're outside and they process it?
No, it's because sheep's wool contains cholesterol, lots and lots of cholesterol, which is the precursor for making vitamin D chemically.
Oh. So tell us a little bit about the Ehlers-Danlos syndrome and what you're involved in with that.
Right. So Ehlers-Danlos syndrome is what's called an autosomal dominant genetic disorder. So what does that mean? It means that if 50% of your children will acquire it from you. And this genetic disorder specifically affects your collagen elastin matrix, which is basically the scaffolding of your entire body. And so, as a result, patients with this genetic disorder have a wide variety of symptoms that they will go throughout life, going to their doctor, explaining these symptoms, only to be frustrated by either not being appreciated what the cause was, or to be suggested that they're doctor seeking or being depressed, and that there's really little else that we can do for you. So when you begin to think about Ehlers-Danlos syndrome and thinking about the defect, right, it's altering your collagen elastin matrix. So one of the first obvious consequences is increased joint laxity. The joints are much more stretchy and often can even dislocate. So many of these patients will have a TMJ disorder of clicking and sometimes even dislocation. They also have, interestingly, and we don't understand why, they have a high palate and they wind up having their teeth being crowded, requiring intervention. Their skin is doughy in texture. It's also more elastic, and because your blood vessels also contain collagen, is that they're more prone to easy bruisability and sometimes even poor wound healing. Many of these patients will complain that when they get up quickly, they feel lightheaded. And often the doctors will tell them, well, you're probably dehydrated, drink more water, and it doesn't do any good. And so they often just live with it. They realize that if you get up slowly, you're less likely to feel lightheaded and your heart beating fast in your chest. But what is really happening? What's happening is that when you get up quickly, your blood vessels constrict quickly, and they can't do that as well if they're more elastic. So the blood flows out of the brain gets upset, tells the heart to speed up, and as a result, people feel lightheaded and their heart is beating faster in their body. It's called postural orthostatic tachycardia syndrome. We also know that patients with this genetic disorder will tell their doctor that they just feel uncomfortable eating a normal-sized meal. Why is that? Well, the reason is that your stomach also contains collagen elastin. And normally when you're eating, that you have peristalsis and the stomach is pushing the food down. But if your stomach is more elastic like a balloon, it starts to blow up like a balloon and it feels uncomfortable. So often patients with Ehlers-Danlos syndrome learn early on to eat smaller meals multiple times a day. And this sometimes actually can lead to obesity because their satiety center can't be satisfied. This is a big problem for infants because infant being breastfed, right, they can't tell you that they feel uncomfortable. And so they wind up spitting up a lot, their breast milk or their infant formula. Often pediatricians will conclude, well, this is just normal for an infant, or maybe it's gastrointestinal reflux. And they sometimes will even put these infants on gastrointestinal reflux medication. But it turns out it's likely due to this genetic disorder. It's called gastroparesis. And like I said, the simple fix is, and I tell moms, is to give smaller feedings multiple times a day to get the same number of calories so that they're not calorie deficient and they do much better. These infants also have what's called skin mottling, where all of a sudden there's areas of blue and red and white that kind of come and go. It almost looks mysterious. But this is due to what's called dysautonomia, where the nervous system is having alterations in capillary blood flow. And so sometimes it looks blue and sometimes it looks a little bit red because the blood vessels are expanding. And it's often a classic sign for this genetic disorder. Often the parents will complain, you know, I pick up my child and I can feel the joints clicking. I wonder why. Well, the reason is, just like I said, the joints are hypermobile. And so as a result, they're popping in and out. And so I often advise parents to try to stabilize them, like with ACE bandages. Because if you don't, or you're constantly having those joints clicking in and out, that you wind up destroying the articular cartilage and ultimately leads to earlier onset osteoarthritis. So these are the many different complications associated with this genetic disorder. In addition, it's well documented that adults with this genetic disorder have a 10 times higher risk of fracture compared to an adult matched for sex and age and ethnicity. Why? Because a major component of your bone is collagen elastin. And so the way I reason it is the following. If you're building a bridge with steel rebar and concrete, you have a very stable structure. So patients with this genetic disorder, you replace the steel rebar with plastic. So even though you put the same amount of concrete into that structure, it's going to have a lot more give, and they're more prone to fracturing. And so it's well documented. They've done a study and showed in healthy adults with Ehlers-Danlos syndrome compared to an adult matched for sex and age, when they took an x-ray of their spine, they were shocked to find that they had had previous fractures that they never knew about. And so it's well documented that they have a 10 times higher risk of fracture compared to, like I said, a adult matched for sex, age, and ethnicity. So now the next obvious question is, if an adult is at higher risk of fracture, what about infants who have even much less concrete in their bones? And if they still have a lot of of flexibility in their skeleton, are they at risk? And so we published in 2017 72 cases where a parent or parents were accused of child abuse because their infant was found to have multiple fractures. And we evaluated these parents and found 93% of them had this genetic disorder, at least one parent, which meant that their infant had a 50% chance of acquiring it. We also found that the other 7% was purely due to vitamin D deficiency rickets. Because if you don't have adequate vitamin D for your infant, the calcium cannot come from the diet. And so the body starts to take it out of the skeleton. And they can't put any additional calcium into the skeleton. And so it makes them a lot more prone to fracturing. And we've demonstrated that in this publication. So what is the relationship potentially with Ehlers-Danlos syndrome and child abuse? Because it's been argued that the only two possible diagnoses, if you bring an infant in, say for upper respiratory tract infection, and they find fractures of the ribs, they test a genetic test known as osteogenesis imperfecta, which is fondly known as OI. Extremely rare genetic disorder. I've had about 4 whole families, that's part of my clinical practice over the past 40 years. If that genetic test is negative and they cannot find another metabolic cause, then it's likely due to non-accidental trauma, i.e. child abuse. And so I had a patient a couple of years ago referred to me by an orthopedic surgeon, and she had difficulty in healing a fracture in her arm. And so I evaluated her and found that she had Ehlers-Danlos syndrome. And I explained to her that she needed to take adequate calcium, adequate vitamin D, and I put her on a very special medication to see if I could help heal the fracture. But this young woman, of course, is in her childbearing years. And so I told her if she gets pregnant, stop the medication, call me, and then let me know after a pregnancy, and then I'll put her back on the medication. Sure enough, she gets pregnant several months later, stops the medication. I call her back after her pregnancy and ask her, how are you and your son doing? And she said, oh my heavens, my son was found in utero to have fractured both arms, both legs, most of his ribs. A total of 23 fractures had occurred in utero. And these were demonstrated after birth by X-ray. And so high-resolution ultrasound in utero identified those fractures. The child tested negative for osteogenesis imperfecta. There was no other metabolic cause. So if that infant had been brought in by mom at 8 weeks of age with an upper respiratory tract infection, they would have found all of those fractures. And that mom and dad would have been accused of child abuse, and her child would have been taken away from her, likely put up for adoption, and likely have felony child abuse charges against the parents. We have a clinical research program called the Ehlers-Danlos Clinical Research Program. And I'm setting up a website that will be operational, hopefully within a short period of time, called the Ehlers-Danlos-Project.com. All of this information is going to be on that website. And I'm going to try to help and advise parents who have this genetic disorder how best to deal with it for both themselves, their family members, as well as their infants. But bottom line is that we have now, for the first time, identified a new cause of in utero and obviously therefore infantile fractures that is not associated with osteogenesis imperfecta or any other metabolic disorder. And because they participated in our Ehlers-Danlos clinical research program, we obtained their buccal swab. And we did whole genome sequencing, and we identified the genes that we believe for this particular infant is the major cause for his fractures. He's now doing a lot better, which I'm pleased about, and it's a worthwhile story to tell, because literally, in my opinion, hundreds, if not thousands of families have been decimated by the inappropriate, in my recommendation, diagnosis of non-accidental trauma for infantile fractures. No question that child abuse is a major concern and needs to be carefully watched for and prosecuted. But we can't have parents, innocent parents, being accused of child abuse if they have a genetic disorder that is impacting on both themselves and their infants' health, including their bone health.
So where is the abuse coming from? Is it from their not taking enough vitamin D, or there was actually physical trauma that was causing those?
So these fractures are likely being caused by just normal handling. Or, for example, if you're burping the infant, right, a little bit more aggressively because you're trying to get the infant to be burping, you could be wind up fracturing the ribs. The infant could be crying, but you might think, well, it's because the infant's just fussy, right, or not eating, or whatever, not realizing that the poor infant's fracturing the ribs.
And the ribs are brittle because?
So the ribs are brittle because the major component of the skeleton is much more flexible, right? Like I said, the story of the bridge, right? It's the same story, is that instead of having steel rebar as part of the major component of the rib, in fact, you have plastic rebar. And as a result, it has a lot more give and is much more fragile. And that's why adults with this genetic disorder have a 10 times higher risk of fracture.
And that's because of vitamin D deficiency?
So it's totally separate from vitamin D, right? Vitamin D deficiency independently can cause the problem. So now think about it. If you're vitamin D deficient and you have Ehlers-Danlos syndrome, you have now two potential causes of causing bone fragility, and puts that infant at even higher risk of fracture. Now I also mentioned, right, that easy bruisability, poor wound healing, is associated with this genetic disorder. And so sometimes infants are being brought in with a bruise, right? And the parent is concerned about the bruise. And so instead of the parent being reassured because the mom has easy bruisability, has this genetic disorder, no. These bruises are often considered to be caused by child abuse. And so another issue that needs to be taken into account when evaluating an infant for potential non-accidental trauma. Well, I think the first thing that needs to be done, that was recently done in India, is that there needs to be better food fortification programs throughout the world with vitamin D. That could instantly improve the world's vitamin D status for both infants, children, and adults. So that would be certainly high on my list for recommendations.
And what food products would you put them in?
Well, it turns out that, for example, in India, the two most common products that works for them would be dairy, certainly for children, and cooking oil, if you can believe it, right? Because everybody has cooking oil.
Does it preserve well in the oil?
And so it turns out that vitamin D is fat soluble and it's heat stable. So it's heat stable up to about 400 degrees Fahrenheit. So you can cook with the cooking oil with vitamin D and it will get infused into the food. And this is why salmon, for example, if you were to cook it, right, it's a major source of vitamin D. And the reason is that vitamin D is heat stable. I think that it would be nice for NIH to be funding more research in the field of vitamin D. I think in light of this COVID pandemic and the information that's coming out from many laboratories that vitamin D plays a critical role in immune function, helping to fight infections, that studies should be funded to be able to answer that question once and for all. Because if it's true, it's a simple fix in reducing risk of infections. As I said, we had demonstrated a year ago in 191,000 COVID-positive patients, if they were vitamin D sufficient, they had a more than 50% reduced risk of acquiring the infection.
And what about healing the infection once you've got it?
Say what?
Once you already have the infection,
Yep.
then you take vitamin D. Does that help, like, sort of cure it?
Right. So it turns out that we've done studies here showing that improvement in vitamin D status will improve immune function. We did a study in healthy adults, and we gave them either 600 units, 4,000 units, or 10,000 units a day for half a year. And we took their white blood cells, and we asked the question, what are the genes in their white blood cells doing in response to the vitamin D? And what we found was that a little over 150 genes were changed in those taking 600 units a day for 6 months. About 300 were changed for those taking 4,000 units a day. But those healthy adults that were vitamin D deficient or insufficient at the time we started the study, on 10,000 units a day, over 1,200 genes in the immune cells that are circulating in your bloodstream were being influenced in a very positive way. So we do believe that vitamin D does play a very important role in immune function and helping to fight infection.
I don't know, do you want to comment on the vaccines at all?
No.
Yeah, okay. Off the record, right?
Well, I mean, I can make one comment about the vaccine, which is there is some data to suggest that if you're vitamin D sufficient when you get the vaccine, that it may have more of a benefit.
Oh.
And so the two websites are the Ehlers-Danlos project.com and drmichaelholick.com. These two websites are going to be up and going within the next week or two. Like I said, put a GoFundMe URL on it to help me both in my research with Ehlers-Danlos syndrome and helping me in terms of defending many of these unfortunate parents that have been, in my opinion, falsely accused of child abuse when their only real sin is that they have a genetic disorder that causes bone fragility that they passed on to their child.
Amazing. Thank you so much, Dr. Holick. What a great moment to be with you. And did you want to comment at all about your almost going into outer space, or what was that story?
So the story is that, there are, I guess, two stories. One is that I got a phone call one day. So I've been a consultant for NASA for 35 years and actually chaired some of their programs on human performance. And this was mainly related to muscle and bone health. So I got a phone call one day from my good friends at NASA, and they said that we have a contest for high school students, because they really wanted to get high school students involved in the program. And they asked the high school students to write up an experiment that they would put on the shuttle, and that they would pick what they would consider to be the best and most rewarding experiment. And so John Bellinger, a high school student at the time, had a simple concept, and he asked the question: a developing egg, the chicken has to constantly turn the egg. Otherwise, the yolk sits at the bottom, and the embryo can't develop. And so that's why poor mother hen is constantly flipping the egg. So he said, what about in a weightless environment? Is it possible that the egg yolk would be in the center, so you wouldn't have to turn it, and that it would be perfectly fine and it would develop normally? And so NASA asked me the question, is there anything else that might be of interest? And I said, well, wow, wouldn't it be neat to see whether or not weightlessness had any effect on bone development in a fetal chicken? And so what was done was that they sent up eggs that were 1 to 2 days fertilized and ones that were 2 weeks fertilized, because the whole cycle was about 3 weeks, and the shuttle was going to be up there for about 5 days. And during that last trimester, that last week, is when the chick embryo develops the bones, puts in all the calcium and mineral. And the question is it going to be the same? Because we know that astronauts, they lose a significant amount of their bone because of weightlessness, because the body thinks you don't need it anymore, so why should it be there?
Mm-hmm.
And so the obvious question is, can we procreate in a weightless environment, right? Would weightlessness have any impact on bone development? And so, at least from our chicken study, and I'll show you the poster outside, is we showed that the bones developed perfectly normally in a weightless environment.
And therefore?
And therefore, likely in the future, right? I mean, Branson just had gone up into a weightless environment, and there's no question that one day we will be exploring Mars and likely colonizing the moon, and it's very likely that weightlessness will not have any significant impact on embryo development, including the skeleton.
So I guess my last question is, what's in it for you in the future? What do you see for yourself in the future and for your research?
So we're right now developing a new form of vitamin D. It's the vitamin D metabolite that I had identified in your bloodstream back in 1970. Because it has an extra what's called a hydroxyl group, which means that it makes the vitamin D less fat soluble or more water soluble. We asked a question, and that is, we know that patients with gastrointestinal inflammatory bowel disease or gastric bypass surgery, that they can't absorb vitamin D very well. But what if you now make it more water soluble? Will it be more bioavailable? And the answer is yes. We published this recently and showed that 25-hydroxyvitamin D, the major circulating form, if you take it orally, works very well in patients with fat malabsorption syndromes. We also asked another question, which is, what about obesity? Remember I said that in obesity, the vitamin D gets diluted out. But what about if you give 25-hydroxyvitamin D to an obese person versus a normal weight person? Will it make any difference? And the answer is no, that you raise the blood levels to the same degree. So there's good possibility in the near future that 25-hydroxyvitamin D may be available as a pharmaceutical, possibly even over the counter, as a way of rapidly improving your vitamin D status. The other area of interest, of course, is Ehlers-Danlos syndrome. I would like to be able to identify the genes responsible, because this genetic disorder lasts from birth until death. And so it would be really nice to be able to figure out which genes are involved and to be able to develop approaches to be able to help these people with various medical conditions. And so that's a major program underway. And like I said, the GoFundMe program will help me in that effort.
Fabulous. Thank you so much, Dr. Holick.
My pleasure.